First thing it's very important to say is what an amazing profession midwifery is, and that people come into it, enjoy it so much, and how rewarding it is as a profession. But with that reward comes responsibility and challenges as well. And as a course here at the University of Brighton, we really feel that we prepare our students for that challenge and responsibility when they go out into practice. I think that's one of our very strong points here.
Midwifery is a profession where you're caring after well women. It's a profession where you care for women in partnership. So it's a really positive relationship where you go through the journey of a woman's childbirth. We work here within the University of Brighton with 3 very positive NHS trusts, and you'll get experience of care for women in all sorts of environments, which fits very much with the government agenda.
So within the school I offer to support students in a range of teaching opportunities, including simulation. We use some high fidelity simulation to offer opportunities to engage in obstetric emergencies and understanding the point of view of the woman and both the clinical staff involved. I teach on a range of clinical skills that are less high fidelity, so we teach very simple skills like venipuncture and cannulation using mannequin techniques, and then obviously I have a classroom base as well where I lecture and facilitate learning in a whole range of things from supervision of midwifery, clinical skills, reflective practice, autonomous practitioners, and just working within the NHS system, which is where most of our midwives will end up being employed.
All midwifery courses within the United Kingdom are regulated by our professional body, the Nursing and Midwifery Council. So there's lots of similarities between lots of the courses. So for example, all the courses are based on roughly a 50-50 split, which is 50% of the time in theory, that's both at university and independent study time, and then 50% of the time out in practice, and that's working with women and their families under the supervision of a mentor. We understand that students, the thing that they're most anxious about when they come on the course is their assessments, and that they really want to have a lot of support with their assessments. And we have a wide range of assessments. We have essays, different types of essays, reflective essays, reports that you can write. We also have examinations, we have practical examinations, we have written examinations, and then we also have presentations so that people become very good and confident to actually give them presentations as well. So because we have such a wide range, that really gives all students the opportunity to shine in some area that they'll be good at. So it gives that range of opportunities there.
So as a student at the University of Brighton, you will have the opportunity to care for women in all sorts of sites and settings. Not only that, as an education provider, we provide a very good educational environment. We have modern, up-to-date curricula, we have very good library facilities, we have digital technology. So the programmes very much fits around you as a woman, sometimes as a man, but certainly as an older, mature person with childcare or caring facilities. So a profession of midwifery is open to anyone that actually cares about women.
We're really normal based, it's really midwifery focused, and in promoting normal childbirth and supporting women.
The best thing was probably the support received by the personal tutor in particular. I'm from another country and I was not used to have someone to contact at any time with any worry. So that was for me really good.
Sharing the woman's experience happens in year 1 and 2, and it's where students have the opportunity to follow 2 women throughout the year, through their pregnancy, through their birth and in the postnatal period. This gives them the opportunity to see what it's like from the woman's point of view rather than from the midwife's point of view, because we can teach students what it's like to be a midwife, but to actually know what it's like to be a woman going through the services is very important, and that focuses on normality in year 1 and then complications in year 2. In year 3, the students then have an opportunity to carry a caseload of women where they follow 2 women again through the antenatal, interpartum and postnatal period, but this time they actually get actively involved in the care of the women. This gives the students the opportunity to do some of the care independently. They will be supervised by a mentor at all times, but it gives them the opportunity to start experiencing decision making, which leads into them becoming autonomous practitioners and really supports their decision-making process.
To have the opportunity to study midwifery was great, and the best thing was the options that we have, rotating in different places and having a good combination of lectures and practice.
The third thing I wanted to talk about was the elective opportunities that our students have in year 3 of the course. These can either be international or domestic elective experiences. It's up to the students, they can choose which one they want to have. We have, for the international electives, we have opportunities for students to go within Europe, to go to Australia, to go to America, to go to Africa, and we've even had one student this year go to Nepal, and the students really enjoy that experience. It's a 2-week experience at the beginning of year 3, and it gives them the opportunity to see what maternity care is like worldwide and given that international perspective. They may choose to go somewhere that has a different demographics than we have here on the southeast coast. They may choose to go and work with younger mothers, with older mothers, with mothers that have different complications than we normally see. So it just to widen their opportunities of seeing different cultures within our own country as well.
I think you need to keep an open mind, but you also need to stay true to yourself. And that you'll get there, and when you do, it's amazing.
And it's the best thing I've ever done. I did my nursing and I wanted to do midwifery, and I'm really glad that I've done it. It's great.
The other thing to think about midwifery is what midwifery is about. As a midwife, midwife means with woman. So being a midwife is about being with women, and that's fundamental. You are a practitioner in your own right. It is a profession in its own right. And the 3 years or 18 months you're with us will equip you with the skills you need to care for women and children throughout their journey.